Now let us see how this coronavirus is transmitted. Infected carriers are able to shed the viruses into the environment, and coronavirus is mainly target the epithelial cells. They are transmitted from one host to another host depending on the coronavirus species by either an aerosol, fomite or fecal oral route. So this is how it is being transmitted from one person to another. So either it may be in the form of an aerosol or as a fomite or fecal oral route it is being transmitted. Incubation period is 2 to 14 days. According to CDC, we say that the mean incubation period is estimated to be 4 to 5 days is the incubation period we say. As a safe precaution we are saying to have a period of 2 to 14 days away to prevent infection to be spreaded from one person to another. Coming to the complications in people who have developed COVID-19, that is acute respiratory disease syndrome, irregular heart rate, cardiovascular shock, severe muscle pain, fatigue, heart damage or heart attack, multi-system inflammatory disease in children or pediatric multi-system inflammatory syndrome. So these are the complications that can arise with the COVID-19, and these all are very rare. But if the person is with a risk category, that is with any of the systemic illness or any illnesses with the patient of past history, or the patient age is or a patient is overaged or postnatal or antenatal, then the complications are the patient is at risk for more complications. So the target population, especially the vulnerable group, are high risk for complications during COVID-19. Now let us see the diagnostic features. Mainly we are having three tests, that is molecular test, antigen test and antibody test. Molecular test is also called as RT-PCR test, that is rapid polymerase chain reaction test, and we have antigen test and antibody test. So molecular test is a diagnostic test to detect active infection, whether the person is with active infection. For that, to identify that, we are using this molecular test, and it is being done with nasal or throat swab. It is highly accurate test, and we will get the result within 4 hours or up to a week after testing. Coming to the antigen test, a diagnostic test that can detect the active infection very quickly, we are doing the active antigen test. So here also we are taking nasal and throat swab. Positive results are highly accurate, but negative results may need a confirmation from a molecular test. So within an hour we will be getting the result. Coming to the antibody test, so a test that detects antibodies the immune system created in response to past infection. So whether the person affected in past, to whether the patient is affected with past, because the person itself may not be knowing that the person is affected, because person may not be having any signs and symptoms or affected because of that. So to identify whether the patient is having any antibody against the COVID-19, we are doing this antibody test. For that, we are checking through the blood, and occasionally a second antibody test is needed for a better accuracy, and we are getting the result within 3 days of time. And as I told, RT-PCR is also called as molecular test. If the result shows if it is positive, that means there is a presence of SARS-CoV-19. And if the patient is with clinic correlation with patient history and other diagnostic information is necessary to determine the patient infection status. So if the patient is with a past history of any other systemic illnesses, then the status of severity of the illnesses is more. So you can see in the picture how this test is being done for molecular test and antigen test, how the throat and nasal swab is being taken. And another diagnostic feature is by CT scan. Chest CT scan is being taken. You can see the bright portion, and that indicates COVID positive. So through the CT scan it is used, and it is mainly done reserved in the hospitals, and mainly for symptomatic patients with specific clinical indications we are advised for the CT scan for the confirmation. Now let us come to the main part of the COVID-19, that is prevention. There is currently no approved post-exposure prophylaxis for the people who may have been exposed to SARS-CoV-19. So there is no post-exposure prophylaxis, that is most sad thing about the disease, because if you are carrying a patient, you have to protect yourself, otherwise you may contract the disease. So there is no post exposure prophylaxis for this COVID-19. So how to protect yourself from COVID-19? So that is by keeping a distance. We are saying previously we were saying it is 1 meter. Now we are advising to have a 2 meter distance. That is social distancing of 2 meter, and proper hand hygiene, avoiding touching the face and nose, avoid doing handshaking, good surface cleaning, making the environment safe to handle, proper hand hygiene. All this helps to will protect you from COVID-19. As per CDC recommendation, we are advising to do hand washing with soap and running water for at least 20 seconds. So remember, when you are doing hand washing with soap and water, see that you do it for 20 seconds. And if you are using alcohol based hand sanitizer, you have to use it with at least 6% alcohol. So always when you are purchasing or using the sanitizer, please check it out whether it contains 60% alcohol. Then only it kills 99.9% of bacteria on hands for 30 seconds after application. So remember that once you are after hand washing with soap and water, you must use the hand sanitizer, and this hand sanitizer must include 60% of alcohol, and if it is applied, and your hand must be completely sanitized, virus free, bacteria free after the application of 30 seconds after application. So it will kill 99.9% of viruses and bacteria. So that's how we must use this. And once using the sanitizer, you must rub overall surface of both hands until the hands are dry, about 20 seconds. So you have to wait for 20 seconds and rub it off till the hands become dry. Then only you are supposed to touch any more. So this is how the CDC recommendations for hand hygiene. You have to wash hands with soap under running water when it is visibly dirty. If your hands are not visibly dirty, then you can use alcohol based rub. Otherwise, surely you have to wash with soap and water. And when all you have to wash the hands after coughing and sneezing, when caring for sick, before, during and after you prepare the food, before eating, after toilet use, when hands are visibly dirty, after handling animals or animal waste. So all these areas you are supposed to wash your hands. So remember the points which all time you are supposed to wash your hands. And you all know how to wash the hands. Once again, I'll just remind you, that is, you can take a sufficient amount of soap and cover it on the hand surface, rub palm to palm, right palm over the left palm, interfaced, interlocking, vice versa you have to do, palm to palm you have to interlace, and back to the fingers, opposing the palms with fingers interlocked, and rotational rubbing of the left thumb clasped in the right thumb and vice versa, and rotational rubbing backwards and forwards with clasped fingers of right hand in left palm and vice versa. You can see the picture, 7th picture, that is the rotational rubbing you can see, and rinse the hands with water. Dry hands thoroughly with a single use towel if it is available, and use the towel to turn off the knob of the tap. Now then you can say the hand is safe. And you can use the sanitizer if it is available to make the thing more safe. So we can say total of 40 to 60 seconds or minimum 20 seconds you are supposed to do this hand washing procedure. So I hope you all are practicing this and you are aware about this hand washing. So again, coming to the next aspect, that is when not wearing a mask, a CDC recommend to when you are sneezing or coughing, you have to use inside of the elbow, as I told earlier, to prevent the spread of aerosols. So proper hand hygiene is very important, and healthcare professionals interacting directly with COVID-19 are supposed to use a respirator, at least protective NEOS certified N95 or equivalent, in addition to other personal protective equipment. So it's not sufficient to have a hand hygiene itself with soap and water and hand sanitizer. We are also use a respirator and 95 masks. So now let us see in detail